Watch this.
We've shared the plight of Idaho's nurses during the pandemic. Now students in Boise State's nursing program are seeing it firsthand and getting hands-on experience inside Idaho's overwhelmed hospitals. The controversy continues for Dr. Ryan Cole. The newest appointed member to the Central District Health Board is facing investigation from another state because of several complaints into his actions. A chilly, rainy Friday evening in fall. No better time to snuggle up with a good book. Have we got a few suggestions for you? I mean, if you're into that kind of thing. It's been a critical concern through the pandemic, the resources to fight it. We've had conversations about PPE and whether there'd be enough of that. Same with vaccines. Recently, though, the resource conversation has centered on human resources, like the people working in our hospitals to treat very sick COVID patients. Unfortunately, the last 18 months has burned out a lot of medical professionals to the point of leaving the entire field. It makes you wonder, are nursing school students thinking twice about going into the field of nursing? For the most part, the answer to that locally is no. And because of COVID, nursing students are learning more and experiencing more than they ever have.
It's fair to say the lessons in Lab J could one day save a life.
We actually have 6 beds that we use.
Students in the Boise State School of Nursing work here in the simulation center to fine-tune their skills.
These beds are set up like a regular hospital room, so we've got working equipment, working air, we've got mannequins in there.
Kelly Connor, director of the simulation center at BSU, will tell you the mannequins are far more than test dummies.
They are very lifelike. So this is Eduardo Bishop.
Yeah, that doesn't feel good.
Yeah, it hurts, but it's going to help open those lungs up.
Students like John Dye are getting simulated reps to get them ready for real-life work.
Well, I originally was a geologist, and I worked in the oil fields in North Dakota and Wyoming and Montana.
In early 2020, Dye decided it was time for a career change. And what a time he ended up picking to get into nursing.
I feel like it's going to be one of those things that we tell our grandkids, I became a nurse in the middle of the COVID pandemic,
That COVID pandemic forced faculty to get creative and consider how to best approach training nurses that seem destined to deal with COVID.
It's been a time of a lot of creativity and generating new tools to use with students. So that has been very fortunate. Even though it's turned everything on its head and it's been difficult, we've learned a lot of things very rapidly because we had to.
Blood pressure is good.
While the experience here is crucial, students take one step further as a part of their coursework, going inside the hospital to learn on the job.
The hospitals, all of them, especially St. Luke's and St. Al's, have been really proactive in trying to integrate students into the educational scenarios that they can.
Max Veltman is the clinical coordinator for the program at Boise State. He says the work inside Idaho hospitals during COVID helps students develop a unique skill set.
It's training and practice so that at the end of the semester, prior to graduation, they've really taken on the role of the nurse so that they are feeling pretty confident that they're ready to go. Graduate a few months later, they're on their own.
So you need to just breathe in nice and steady and try to get this disc as high as you can get it. And if it makes you cough, that's okay. You can take some good deep coughs. That's what we're looking to do. We're trying to open those lungs up for you, all right?
John Dye, for example, got a fast-track lesson on working through COVID as a student nurse at the VA hospital in Boise.
It was rough, especially a couple weeks ago. We had a lot of COVID patients. They were having to adjust how they operated in order to be able to take the overflow from, Al's and Luke's and other places. We were even getting people that were coming in from Montana and northern Idaho.
Tough work conditions inside hospitals has simply taken a toll on Idaho nurses, burning them out of the job. It's something program leaders address head-on with students.
Nurse burnout is real, and that's something that, again, COVID has forced us to kind of look at how are we getting our students ready, and that's actually a major component of what we're trying to get students to really understand, is that as much as they want to give, as much as they want to help their community, it doesn't matter if they aren't taking care of themselves.
Nurse burnout, which is 100% understandable, is leading to more and more professionals leaving the field. These students know what they're heading into after graduation, begging the question, Why are you doing this?
I never hesitated, like as the pandemic started, in my decision. I knew that, I'm going into this to help people, and I'm going to help them no matter what their, illness is. And so I know that there's going to be a lot of stress, and I know that there's going to be, fear and everything else involved. But that's part of being a nurse. Like there's, if it's not COVID, it's going to be something else. And so I just, saw this as a great experience in sort of how bad things could possibly be. And I figured if I can make it through nursing school in the middle of a pandemic like this, and I still want to be a nurse, then it's probably the right thing for me.
I mean, going straight into the fire, you at least get an idea that they know what they're getting into and they really want to do it. So that's a good thing. But other than like, say, intubating, we're putting that tube down a patient's throat. What other COVID-specific simulations are out there for them?
Well, one thing they're working on, Brian, is telehealth, because with COVID, telehealth has become a really big resource for hospitals and medical centers, where if you don't have to have somebody come in for treatment and you could say, okay, do this, this, and this, and go fill your prescription, they can avoid leaving the hospital. So the nursing students are now working closely to learn about telehealth and how valuable it is. Of course, with COVID, there's a lot of emphasis on PPE, as well as things like respiratory care. COVID has certainly given some emphasis to the nursing field, and it'll be interesting to see really as this class of nurses goes into the field, how they deal with the stress.
And obviously this is something that takes years. You can't just solve this nursing shortage overnight, so at least this is the step in the right direction. All right, thanks, Joe.
I can say that I've saved 42 lives in the last 2 months. I don't prescribe very often. Generally I'm behind the microscope or in the lab, but from one case to another and nobody doing anything. Elderly, obese, 83-year-old, 72-year-old, asthmatic, diabetic, to a T, every person that's had COVID I've treated with this has been better in 12 to 48 hours.
That is the sitting physician on the Central District Health Board, clinical pathologist Dr. Ryan Cole, before he was appointed to that position. Months before, in fact, back on March 4th, during a Capital Clarity event hosted by Idaho's Lieutenant Governor. Dr. Cole, who owns Cole Diagnostics in Garden City, and whose specialty is dermatopathology, studying skin cancer through a microscope, Dr. Cole claimed back in March, as a pathologist, he had prescribed ivermectin to 42 COVID patients over a 2-month period. Because, he said, they couldn't get that kind of help anywhere else. And there's a reason for that. The parasitic drug ivermectin hasn't been FDA or CDC or even WHO approved to treat or prevent COVID-19. In fact, they've actually advised against it. And a vast majority of Idaho doctors have followed that guidance and not given ivermectin to their patients. Well, not only did Dr. Cole go against that guidance back in March, he continued to do so through at least August 17th, when we spoke with him about his appointment to the CDH board. Are you still prescribing ivermectin?
When somebody's acutely ill, I do help people when they need it. So yes, when patients are acute, no other doctor will help them. In the middle of a pandemic, why would I not help somebody?
Do you know, ballpark or even a specific number, how many you prescribed with ivermectin?
Couple hundred.
Okay.
And 95% have been better in 24 to 48 hours.
A couple hundred. And that was a couple months ago, which also happens to be the last time Dr. Cole has responded to our request to speak with him. But that couple of hundred prescriptions, not all of them in Idaho, by the way, as Dr. Cole admitted to the Idaho Capital Sun back in July, his patients were from across the country. Well, those prescriptions, just one of the reasons. There have been not one, but at least 5 complaints filed against Dr. Cole with the State of Washington Medical Commission. Dr. Cole is a licensed physician in Idaho and 11 other states, including Washington, which he was back in 2007. KTVB received summaries of those complaints today, and the allegations center around Dr. Cole spreading misinformation about the COVID vaccine and for prescribing ivermectin to patients, despite the absence of the, quote, proper physician-patient relationship as listed in one complaint. The misinformation part stems from what Dr. Cole has said in interviews, online, and in those Capital Clarity sessions. He's been to a couple of them, like referring to the vaccine as needle rape, or claiming the vaccine has killed thousands, which hasn't been proven. He's also said there is a direct causation between the vaccine and more pregnant women suffering miscarriages. Well, studies show that isn't a fact. And back in that March event at the Idaho Capitol, Dr. Cole claimed the vaccine was a product of a conspiracy, not what it was claimed to be.
What we have right now is an experimental biological gene therapy immune modulatory injection. We are injecting people with a synthetic sequence of nucleic acid. We have never done this on a large scale in human history. mRNA trials in mammals have led to odd cancers. mRNA trials on mammals have led to autoimmune diseases, not right away, 6, 9, 12 months later.
And those claims that you just heard Dr. Cole say have been proven false by several entities across the country. So the Washington Medical Commission says they are investigating Dr. Cole, something Physicians for Human Rights said should happen. About a week ago, they put out a release. Doctors who repeatedly spread misinformation and disinformation about COVID-19 and vaccines should face disciplinary review and actions, including the revocation of their licenses. They're following the lead of the Federation of State Medical Boards, who said the same thing back in July. Now, similar complaints have been filed with Idaho's Board of Medicine, and we're told they plan to take up this issue at their next board meeting. But we likely won't know if they decide to investigate Dr. Ryan Cole. We will only know if they decide to take formal action. But the newest member of the largest health district in Idaho, one that is supposed to guide our public health policies, the lone physician on that board, Dr. Ryan Cole, is under investigation for his views about the deadliest public health crisis we've seen in our lifetime. It's been a busy time on the 208 text line. We're going to get to a few of your questions you sent in this week, covering COVID backlogs, sewer stuff, and puppies? But before we answer those questions, feel free to text us any others you have on your mind, maybe about today's show. 208-321-5614. That's the number. But make sure you include your name and the hashtag the 208. We're going to try and answer and share a few at the end of the show. All right, every once in a while, we like to take the time to clean out our inbox and answer some viewer questions that we haven't been able to get to. After all, the 208 is supposed to be a conversation, a two-way conversation. So let's do our part and try to respond to some of what you've asked us, like this one, which several of you have asked this week. PJ wants to know, I'm curious about the optics of the COVID-19 testing backlog. As those backlogged cases are processed, do they show up as cases on the date the test was taken or the date it was logged into the computer? How is this all sorted out? Similar to what Anita texted in, are the positive COVID cases and deaths numbers actually day of, or are they backlog cases combined into actual day numbers? That's what Anita asks. Well, this is something we've been talking about for several weeks now. Right now, though, statewide cases show they are trending downward, these numbers, but the Department of Health and Welfare has been issuing warnings to take that trend, the numbers, with a grain of salt, because there are still about 2,900 backlog cases that still need to be processed. That seems like a lot, but that's actually down from the nearly 11,000 cases a few weeks ago. The problem lies in the local public health districts and not enough hands to help get the influx of cases processed in a timely manner like we've been used to seeing throughout most of the pandemic. So once they are processed, where are they actually tallied? Well, this is a look at the daily case counts. There are cases that are announced every day, confirmed and probable. Like yesterday, for example, there were 1,328 cases reported to the state. Compare that to this illustration of the onset date of cases. These are the cases that have been reviewed and processed, meaning they have been confirmed as a positive case and they can pinpoint a date. But this chart's still missing those 2,900 cases we mentioned. So far, only 3 of yesterday's cases have been fully processed. So that white bar signifies the dates which illnesses may still not yet have been reported right there, meaning cases, more cases I should say, are likely to appear. So bottom line, once they figure it all out, COVID cases are logged from whence they came. All of this, by the way, is available on the state's COVID-19 dashboard. Then there's this one from Joni. On the sewer issue, how long would the increased rates apply or remain? Joni's talking about the Boise sewer bond that will be on ballots this election day as part of a long-term plan to expand the city's wastewater treatment capacity and replace some aging infrastructure. So here's some background. If voters approve the bond, water renewal rates would increase about 10% or about $3.64 per month. If it fails, that rate jumps to about 53% or an average monthly increase of $19.51 per month. So how long will those additional fees last? The city of Boise says right now it looks like it's going to be based on the length of the financing. The city says they're assuming it will be a 30-year payment, so 30 years would be the answer to that question. However, variables can change how that would impact the need or decrease the increase or decrease or increase those rates. And to be very clear, this isn't your water rate that is going up with this. This is your water renewal rate, which is a fee based on water usage in the winter, which is calculated in hundreds of cubic feet. And this is also a bill you likely get every other month if you are in the Boise Sewer District. So there's that. Well, finally, there's this one. What happened to the to the Basset Hound we showed you just last week? Was that just a tease? The Basset Hound. I've heard something about a Mo. Mo, right? This is a dog we've heard about. See what happens when I go on vacation. All these things kind of get passed through. I've just been handed this note, by the way. It seems that on some Fridays now, according to Joe, the 208 is going to be known as the 2-Mo-8. All right? So here's your Friday dose of 2-month-old Mo. Hey, Mo! Gail Cushman has written and self-published 7 books. The Boise native started out writing murder mysteries, but it was her daughter, Gail tells us, who reminded her to write what she knows. The former Marine told us her daughter said to her, "Mom, you don't know anything about murder, but you do know about being old." So Gail set out to write about that, but with a bit of a twist. Gail started writing her books for those of a certain age back in 2019 when her husband's Parkinson's disease got worse. She did it as a diversion. She's now releasing her 3rd edition of what she calls the Wrinkly Bits series. Yeah, they are books about exactly what that title sounds like. So be warned, you're about to hear some rather subtle references to what certain adults do over a certain age.
I saw Logan again, who was waiting to speak with a desk clerk. I gasped, and my lower deck started turning flip-flops again. At first it was an escape, because I needed an escape when my husband was so sick. I needed to be able to do something different, than just worrying about him, because I knew he wasn't going to get better. I decided, well, I'll write about groups of old people, but what do you call them? Wrinkly bits.
Other people read that and think other things.
You think? I don't know. 5 years into the marriage, she began to age, and the tables turned upside down. When you age, you get wrinkles. When you age, you get gray hair. When you age, you get sore aches and pains. When you age, you get, you forget things. You start talking, and then in the middle of a sentence, you forget where you're going. And now, 20 years later, her wizened face, neck, arms, and spotted hands gave her the look of someone much older. That's why I called it Wrinkly Bits, but I don't know why I wrote it. It just came to me. Every day when I sit down, I don't know what's coming out my fingers. I have these characters that want to come out, and I sit down, and all of a sudden they're flowing out my fingers, and it's an odd sensation.
Speaking of sensations, is it too simple to say these books are about old people's sex?
It's too simple to say that. Yeah, it is. They do have sex, but it's innuendos. It's not. They're not bouncing on the bed, and I'm explaining it to them. Yes, Griff plays the magic blue kazoo, as he calls it. In fact, it helps him too much. You heard him talk chugga, chugga, chugga 3 times a day, whether I want it or not.
These are 70-year-old people with libidos of 17-year-olds.
Yeah, they are. That's what they are. And, libidos don't go away. People think they do, but they don't. And so, I'm writing about libidos of 17-year-olds and 70-year-old bodies. That's what I do.
When you write them or when you read them out loud, do they make you blush?
I suppose they would, in a sense, but I could have my 13-year-old granddaughter read them. In fact, she picked up one and she was reading it, and she said, "What's a libido?" A libido. What's a libido, Grandma? Well, I'm not telling you right now. Logan is the one that she gets that has all the hots for Audrey, and he's a podiatrist, which is a whole bunch of fun. I noticed he watches feet, yours especially. Does he have a foot fetish? He likes to kiss her toes with whipped cream and do naughty things with her.
Toes and whipped cream isn't a thing for you?
No. I don't know anything about toast and whipped cream. I don't. I promise.
When you tell somebody you're an author and they ask, "Oh yeah, what do you write?" What do you tell them?
Romantic comedies. My eyes wanted to take a peek toward his but I willed myself to blink, and I moved my gaze to his left ear. But believe me, it wasn't that easy. Books about people over a certain age who were, kicking up their heels a bit. I blushed, but prayed Carly would assume it was only another hot flash.
Lots of hot flashes in those books, trust me. Wrinkly Bits, Out of Time, Cruise Time, and then the 3rd book, Wasting Time, that's just been released. Time is the thread here with these books because Gail's husband, Tom, passed away in September of 2020. Gail says they were married 51.8 years because, as she puts it, every minute counted. All right, let's wrap up your week here with some comments you sent in during the show, like this one from Jack in Boise. Ryan Cole, Dr. Ryan Cole is on a public health board is what happens when politics trump common sense. Shame on those who voted for him. Then this one, leave Dr. Cole alone. If you think the repeated booster shots are going to end COVID, you got another thing coming. COVID is something we're going to live with. Every one of us are going to deal with COVID-19, and we haven't said we haven't, and we didn't really mention anything about booster shots. But if a doctor on the CDH board is being investigated, I feel we have to report that. What are you saying? I just heard you say a lot of medical personnel are leaving because of burnout. While that is indeed some of the lack of working, it's mostly because the vaccine mandate, hospitals are not telling the whole truth. We've asked them, this is what they told us, it's minimal, those who've quit because of vaccines. We thought we'd leave you with this one, though, for this Friday. We're not the only ones who love Mo around here. It appears Tanny does too. Loves watching Mo. More Mo! Have a good weekend.